Welcome to our Teledoctor Show. My name is Professor Wilbroad, and this week we want to emphasize the topic that is very important to all men, but also close to the women as well, because if your men are affected, we are all affected, and this is prostate cancer. What is it? And today on my show is Professor Bowa. Welcome. Professor Bowa, today we are concentrating on prostate cancer. So what is prostate cancer?
Well, the simplest way to put it is that prostate cancer is a sore on the prostate, which is a gland that sits below the bladder, that grows and eats away the prostate gland and also the bladder and any of the surrounding organs.
So, is there a problem to say that everything that grows in the bladder is a cancer? Can I say something like that?
No, not everything that grows is a cancer. But a cancer is cells that have gone out of control.
Yeah.
They are eating other cells and destroying other tissues. But you do have growths. For example, you can have an infection that can grow, or a growth that can grow, but not invade or destroy surrounding tissues.
Yeah, excellent. So, Prof, how common is prostate cancer in Zambia?
Well, prostate cancer is the leading cancer of the urological system. It's the most common cancer. We don't have the figures quite accurately, but our anticipation of the incidence is about 350 per 100,000. So it's a major problem, even though it was thought that Africans don't ever have or hardly have cancer of the prostate. But now it's being seen that this is one of the leading causes of disease among men.
Even here in Zambia?
Even here in Zambia, especially African Americans and Africans in particular.
Okay. How often do you see, when you, in a month, how many such patients do you see, in your practice?
Let's say a week. I would easily see, if my clinic is 40 patients, I will see 5 to 10 patients who have cancer of the prostate.
Okay. And what are some of the symptoms? Men always come late.
Yes.
They don't want to seek
yes.
care. But what are some of the things that people can pick early in order for them to be detected early? And I'll come to how we treat it. But let's see, what are the symptoms?
The symptoms mostly, if it's early disease, most of them come late. But if it's early disease, they may have some blood in the sperms.
Yeah.
They may have...
in the sperms?
In the sperms. Because prostate cancer starts on the outer side. So it first erodes the duct that carries the sperms before it erodes the duct that carries the urine. So they'll present with blood in the sperms or delay in ejaculation. That's early disease. By the time they are having symptoms, the disease has spread quite a bit on the urine side.
Yeah.
So if they are having to push pass urine or waking up at night frequently, then the disease has spread inward.
Yeah.
So the early symptoms are to do with ejaculation, change in color, some pain when ejaculating, some blood, and so on. But then, as it goes on, then they have difficulty passing urine. They may have pain, they may have blood in the urine. And by the time they start having severe back pain, which they can't sleep, then that is advanced. It has spread to the bone.
To advertise on the Teledoctor Show, please contact 09799040046 or email us on info@teledoctor.co.za. Teledoctor, healthcare in the palm of your hands.
So what are some of the complications we see in prostate cancer?
Well, prostate cancer spreads quickly to the bones of the back in particular. So typically the patient will complain that when he tries to sleep, he can't find a position in his bed, So he has this pain in the bones, which is not relieved by any of the common medicines. He will take all these, but he'll still have a lot of pain. But then the other thing that happens also is that it may spread to other bones. So the person feels that when they're waking up, it's so difficult. The bones are heavy, the joints are creaking. They may also have spread to the blockage of the kidneys. So they stop passing a good volume of urine. They may start having a little bit of nausea and vomiting. And also, when the cancer spreads to the spinal cord, then they start feeling heaviness, pins and needles in the feet, heaviness, unable to walk properly and losing a bit of balance. Those are some of the common problems we see.
Okay, so is there help?
Certainly. There is help for the patient with cancer of the prostate, but if the doctor, the urologist, is seen early, then cure can be provided. If they come a little bit late, we give them some supportive treatment that will prolong life, but the best advice is come early so that cure can be provided by the drugs and the treatment.
So one of the things that men worry about is that if I do surgery on my male organ, many things will suffer.
Exactly.
In the bedroom, at home. What's your comment?
Well, I've had men ask me that question, but at the end of the day, which one is better? To live or to preserve something and then die too early? The thing is that, first of all, the operation is not being done on the male part. The operation is being done on a small gland between the male organ and the bladder. However, the nerves to the male organ pass nearby, so they may be disturbed. And then we have 20-30% of men who have sexual dysfunction after the operation. So there is a small risk, but surely it's worth taking the risk, because there's a small risk that your sexual function may be disturbed. But the greater risk, if you don't have anything done, is that you may die of cancer, and it can spread very quickly.
Teledoctor wants to bring this message very close to the people. I know that you've got a male person in your house, your brother, your husband. What's the message you want the women to carry to their husband about prostate cancer today?
Well, I think that's a very important, because I know women are the health carers in the home. And so the message that I want them to carry is, if their husband, their brother, their male partner is over 45, they should try and ensure that at least once a year they go to the hospital and be screened for prostate cancer. Just that one thing. They convince their partner just once a year to have this screening test to see that their partner is clear of prostate cancer.
Maybe your Valentine present should be to encourage somebody to do something called PSA. Prostate specific antigen, and that can save somebody's life. So glad that you came. Thank you
very much.
The topic for today is sexual dysfunction in men. Statistics show up to about 45% of men might have sexual dysfunction, and this comes with age. I'm with Professor Bowa. Sexual dysfunction in men. Stay tuned.